As advanced practitioners, when we're choosing our modalities and thinking about what we're going to use on our patients, we have to critically think about our goals of the treatment, what the treatment is designed to do, and also the pain that we're trying to address. Is it acute, chronic, neuropathic? Is it referred pain? Is it related to trigger point? Is it sclerotomic? Um, these are all things that come into play when we're trying to decide what type of modalities to use. And as an advanced practitioner, we have to critically think about. I'm briefly going to talk about the thermal methods of pain control, along with what type of modality increases local metabolism, causes vasodilation of arterioles and capillaries, causes increased blood flow to the area heated, increases leukocytes and phagocytosis, increased capillary permeability, increases elasticity of muscles, increases analgesia, increases the formation of edema, and decreases muscle spasm. The first modality we're going to look at is shortwave diathermy. It is also an electrotherapy device, I believe, but it also creates heat, so I think it falls under my topic here. The application of high frequency electrical energy, which is used to generate heat in the body tissues as a result of the resistance of the tissue to the passage of energy. Tissues with the greatest resistance to flow generate the most heat. Depth of penetration is equal to, if not greater than, ultrasound. Can cause therapeutic change in temperature up to 6 to 8 centimeters. Can be used on a thermal or non-thermal setting of using, of course, shortwave diathermy. The non-thermal is the capacitor electrode, and usually continuous cycle. Is usually when the patient is placed between the two electrodes or plates and becomes part of the circuit, creating a series circuit. That's kind of like the electrical outlets series, sort of, when you create that flow of electricity and then you plug something up into it, and you can get that flow of energy. Capacitor electrodes create a stronger electric field than magnetic field. In the picture, you can see how the energy flows whatever from is placed between these two poles, and then becomes part of that circuit. Usually, the patient is placed anything in between there that creates resistance to the flow will generate heat. So this will cause problems in treatment if there's a lot of adipose tissue around the structure you're trying to heat. It'll generally heat up faster, more quickly than other structures, so you have to be careful of creating burns. That's something that happens with diathermy. I think that's why some people are reluctant to use diathermy. Next, we look at the induction electrode. An induction electrode are cable or drum electrodes that create a stronger magnetic field than electrical field. A cable electrode is an inductance type electrode in which the electrodes are coiled around a body part, creating a magnetic field. And in the picture, this is kind of just a generic photo, but normally the limb would be the blue portion, and then the red portion will be the cable wrapped around, kind of like a light bulb filament. And the magnetic field is created on top and on the bottom. And the current that goes diathermy, when the current goes around the rounded coil, which in turn generates heat. It'll again create the tissue with the greatest secondary circular currents called eddy heating effect. And that's where the microwave diathermy creates a stronger magnetic field than electrical field begins to take place. Both diathermies create radio frequencies, and it's regulated by the FDA. Clinical use or practitioner application of diathermies are indicated for muscle strains, contusions, ligament sprains, tendinitis, tenosynovitis, bursitis, joint contractures, and myofascial trigger points. I personally don't know a lot of practitioners who currently use diathermy. I don't really know a whole lot of practitioners, I guess, probably. I also know that in my therapeutic modalities class, we didn't spend a whole lot of time on diathermy. I do remember going over it, but it wasn't stressed as some of the other modalities that we use commonly in the clinic. Draper and others conducted a study to determine if shortwave diathermy increased range of motion in combination with prolonged stretching, and determined that shortwave diathermy is effective in this manner. The study concluded that pulse shortwave diathermy application before prolonged long duration static stretching was more effective than stretching alone in increasing flexibility throughout 3 weeks. After 14 treatments, prolonged duration stretching combined with pulse shortwave diathermy followed by ice application caused greater immediate and net range of motion in causes than prolonged long duration stretching alone. This study was actually secondary to a previous study completed by the same group to determine the effects of shortwave diathermy and short duration stretching, and the finding was not supportive in that manner. In fact, the stretching needed to be for longer periods of time in order for the shortwave diathermy to cause an effect. And here we see the contraindications and indications of when to use shortwave. Some of the benefits to using SWD or any type of diathermy are that they can produce a deep heating effect equal or greater to ultrasound, can create a change in tissue temperature greater than 6 degrees, has a longer lasting effect than ultrasound. In fact, the temperature change is usually in between 6 and 8 degrees. And that's a great therapeutic effect as compared to ultrasound. Some factors about diathermy that are not so beneficial are that the units are pretty expensive, anywhere from $5,000 to $20,000 for a unit. As I stated before, this treatment can cause tissue burns, but most often it's because of practitioner error. There's specific requirements for setting up and using, of course, electrical currents, and it is not as dummy proof as some of the other machines that we use. So basically, you really have to know what you're doing. Now, briefly, we're going to talk about ultrasound. Ultrasound is also a thermal modality as well as an electrotherapy device. It uses acoustic vibrations of high frequency, and it causes vibration in the tissues and which generates heat. There are thermal and non-thermal applications of ultrasound, the pulsed and continuous cycles. Traditionally termed with diathermy as a heating modality used for elevating tissue temperature, and is most commonly used as a tool in improving range of motion. The idea is to alter the elasticity of restricting tissue to aid in the effort to stretch the tissue. There are 2 different types of waves when dealing with ultrasound: longitudinal and transverse. Longitudinal is the primary waveform, and it travels in soft tissue with molecular displacement along the direction in which the wave travels. Transverse occurs only in bone, and the molecules are displaced in a direction perpendicular to the direction in which the ultrasound is moving. And then there are areas of high and low density in each wavelength, and respectively they're called compressions and rarefactions. And a review of the frequencies of ultrasound. You have your 3 megahertz superficial heat. Energy is absorbed superficially with a depth of penetration of 1 to 2 centimeters. 1 megahertz equals deep heating, and energy is absorbed much deeper at 2 to 5 centimeters. And the depth of tissue penetration is determined by ultrasound frequency and not intensity. That was one of the harder concepts to push, I think, in my therapeutic class, if I remember correctly. Something that's kind of iffy when working with ultrasound, I think, is the beam non-uniformity ratio. Amount of variability of intensity within the ultrasound beam and is determined by the maximal point of intensity of the transducer to the average intensity across the transducer surface. 1-to-1 is the ideal, but of course not really possible. So the most common is 4-to-1, and the higher the ratio, the greater the chance of hot spots forming during treatment. Indications of ultrasound are shown here. Soft tissue healing and repair, chronic inflammation, bone healing, increased blood flow, increased collagen extensibility, pain modulation, and reduction in muscle spasm. Contraindications are acute and post-acute conditions, areas of decreased tissue sensation, areas of decreased circulation, vascular insufficiency over the eyes, infection, cancer, pregnancy, or if the patient has a pacemaker.